Okay, thank you. I have no disclosures. And thank you very much for letting us present our study. So there has been concerns that starting exercise training in the early postpartum period may negatively affect the already stretched and weak pelvic floor muscles when recovery from pregnancy and childbirth is not completed. And we don't know much about this relationship because there is a paucity of knowledge in how we can guide women in postpartum exercise training. So the aims of this study was to investigate whether general, regular exercise training within the first 6 months postpartum influence pelvic floor muscle function 12 months postpartum, and how it is associated with symptoms of stress urinary incontinence and symptoms of pelvic organ prolapse at the same time point. So women were asked at 6 weeks postpartum if they're exercised or not. And regular exercises were those exercising 3 times or more per week for 30 minutes or more each time. And non-exercises for those exercising 0 to 2 times per week or reported only during strolling. And then we assessed the outcomes of vaginal resting pressure, pelvic floor muscle strength, and muscular endurance using manometer on 12 months postpartum, and symptoms of stress urinary incontinence and pelvic organ prolapse also at 12 months postpartum using electronic questionnaire data. So this study was a sample of 167 primiparous women with mean age of 28.7 and mean BMI of 24.7. And 42% were regular exercises, and 58% were then characterized as non-exercisers. And type of exercise was pooled due to only 8 women reporting high impact, that's running and jumping exercises, and high impact aerobic exercises. So this is really a study of general, regular, and then low impact exercisers. So we did a standard multiple regression analysis looking into associations of exercise training 6 weeks postpartum on vaginal resting pressure, pelvic floor muscle strength, and pelvic floor muscle endurance at 12 months postpartum. And there was no associations between starting early exercise and the impact on the pelvic floor. And we did a logistic regression looking into the associations between exercise training 6 weeks postpartum on symptoms of stress urinary incontinence and pelvic organ prolapse. And here as well, there was no differences, there was no associations between starting exercise 6 weeks with symptoms of stress urinary incontinence and pelvic organ prolapse. So to conclude, starting regular general exercise training 6 weeks postpartum does not negatively influence pelvic floor muscle training, pelvic floor muscle function, or symptoms of stress urinary incontinence and pelvic organ prolapse. And based on the results from these studies, we can recommend that general regular physical exercise in the early postpartum period, but these women in this study does not do much of strenuous exercises, so it remains to study the impact of more strenuous exercise postpartum on the pelvic floor. So thank you for your attention.
Thank you, Merete. While we're waiting for questions, may I ask, did you collect data on when they started exercising between 0 and 6 weeks? Do we know if it was week 1 or week 5?
It's within the it's within the last 4 weeks, so from week 2 then.
Okay.
Yeah.
Thank you.
Hi, very nice study. It's Jenny Kruger here from New Zealand. Did you have any information on the delivery type or mode of delivery?
Type of delivery?
Yeah.
Yeah. This was a mix of both vaginal deliveries and cesareans. I don't remember the percentage now, but at least we have 10%. 10% of having cesarean sections. Yeah. And it was really low prevalence of having major perineal tears. Those were also really low, I think, but at least under 10%. Yeah.
Okay, cool, thank you.
Thank you for a very nice presentation. Chantal Dumoulin from Montreal. I have 2 questions. The first one is, can you tell us a little, some examples about these lower intensity exercise that they were doing?
Yeah, it was fast walking.
Okay.
It was bicycling, swimming, horseback riding, low impact exercise, aerobic exercise. strength training. Yeah.
Okay. Thank you. And the other question is regarding the non-exerciser. 2 times and less were considered not to be exercising. Why didn't you decide to consider only those that were not doing exercise? Between 2 and 3, do you think there's something there? Or?
Yeah, because of the numbers, of course, but we also compared those answering never. And there was no difference between those either, but that, of course, can be due to lower numbers. Okay. Yeah.
Thank you.
Yeah, you're welcome.
Hi, thank you for your presentation. Marianne Alperin from University of California, San Diego. I have a couple questions.
Yeah, sure.
My one question, were the women who were subjects enrolled in this study, were they also doing pelvic floor muscle exercise?
Come again, sorry.
Were they also doing pelvic floor muscle rehabilitation?
Yeah, these women? Yeah, there were a few of them. I think also prevalence, the numbers were like 30%.
And it didn't matter which group they felt?
No difference.
But my other question was about the impetus for the study. What is the biological plausibility of detrimental effect of starting to exercise on the pelvic floor muscles shortly after delivery? Why would that be?
Why it would be a problem? Yeah.
Well, obviously you showed that it isn't, but why? Why do we have this question? I guess.
No, I think women are concerned also because of the media, that we sort of build up some sort of fear of starting too early because we don't know, and I think we just think that because of the muscles already been wear and tear, that maybe adding more impact on it might be harmful, but we really don't know. It's more of a hypothesis.
Oh,
and I think also the media doesn't really contribute to making exercise a safe procedure.
Well, thank you for debunking that myth.
Yeah. Okay.